In our project, we will be explaining the movement, muscles, joints, and bones of the lower limbs that are involved in a simple kick of a soccer ball. We'll play the full video in slow motion so that you can see the full movement, and then we'll break it down into 4 different frames.
Here in the starting position, we'll first look at the left hip. The acetabulo-femoral joint is one of 2 ball and socket joints in the body. The head of the humerus articulates with the acetabulum of the pelvic girdle. The ball and socket joint is a triaxial synovial joint, which means it can move in all directions and in all planes of motion. In this case, the left hip is neutral, which means it's not flexed, extended, or rotated any way.
The knee, or tibiofemoral joint, is a synovial uniaxial hinge joint, which means the bones that make up the joint can only move along one axis to extend or flex. In this case, the knee is almost fully extended, maybe a little flexed, which means the angle between the femur and tibia is just less than 180 degrees. Knee flexion occurs in the sagittal plane, and we'll discuss the muscles involved in the knee flexion later when the knee starts to flex.
The ankle is the talocrural joint where the tibia and fibula articulate with the talus. This synovial hinge joint dorsiflexes, which brings the foot bones, so the tarsals, metatarsals, and phalanges, towards the tibia and fibula, or plantar flexes, which moves the bones of the foot away from the tib and the fib. In this stage, the ankle is in anatomical position, which means it's neutral.
Now, looking at the right leg, the right hip is neutral, not flexed or extended, but as you look closer at the direction that the ankle and knee are pointing, you can tell that the right hip is slightly externally rotated. Hip external rotation happens in the transverse plane and occurs when the thigh bone, the femur, rotates laterally or away from the midline. We'll address the bones and muscles involved later when the hip starts to laterally rotate further.
The right knee is slightly flexed, just like the left knee. It looks close to extended, but the angle between the femur and the tib and fib isn't quite 180 degrees. And the right ankle is in a neutral position, just like the left one as well.
Now we see the backswing of the kick begin, and we'll stop it right here to analyze the movements. In this frame on the left leg, the actions of the hip, knee, and ankle joints are the same as the last frame. The hip is still slightly flexed, the knee slightly flexed, and the ankle still neutral. However, because Bennett is balancing on his left foot in this frame, there are a number of muscles that are contracting in order to stabilize his body and remain balanced. These include the gluteus maximus, the gluteus medius, the tensor fasciae lati, the 4 quad muscles that are your rectus femoris, vastus medialis, vastus intermedius, and vastus lateralis. The hamstrings, which are made up of the biceps femoris, the semimembranosus, and the semitendinosus, the 2 muscles of the calf, the gastrocnemius and the soleus, and finally the tibialis anterior. We'll go more into detail about these muscles when we look closer at how each one works.
When looking at the right leg, the hip is obviously extended. Hip extension happens in the sagittal plane and is classified as an increase in the angle at the acetabulo-femoral joint, making the angle between the pelvic girdle and the femur larger. The prime movers, which are the muscles that are most responsible for the hip extension, are the gluteus maximus, which originates in the posterior gluteal line and the posterior sacrum and coccyx, and inserts into the IT band and the gluteal tuberosity. The long head of the biceps femoris, which originates in the ischial tuberosity and the sacrotuberous ligament and inserts in the head of the fibula and the lateral condyle of the tibia. The semimembranosus, which originates in the ischial tuberosity and inserts in the medial condyle of the tibia, and the semitendinosus, which originates in the ischial tuberosity and sacrotuberous ligament and inserts in the medial surface of the proximal tibia. The synergists, which are the muscles that help with hip extension but aren't prime movers, include the gluteus medius, which originates on the external surface of the ilium between the posterior and anterior gluteal lines, and inserts in the greater trochanter of the femur, and the adductor magnus, which originates on the ischiopubic ramus and ischial tuberosity, and inserts on the medial border of the linea aspera of the femur.
Hip extension also has 5 antagonists: the iliopsoas, which originates on the lateral surface of the T12 to L4 vertebrae, and the iliac fossa and crest, and inserts in the lesser trochanter of the femur. The TFL, which originates on the anterior part of the iliac crest and the anterior superior iliac spine, or ASIS, and inserts on the iliotibial band. The rectus femoris, which originates on the ASIS and inserts into the base of the patella. The sartorius originates at the ASIS and inserts into the medial surface of the proximal tibia, and the pectineus, which originates on the pectineal line of the superior ramus of the pubis and inserts on the pectineal line of the femur bone. These muscles are antagonists because they oppose the motion of the hip extension. They are most often used in hip flexion and, for the most part, are on the anterior side of the leg, so they act as antagonists in the extension of the femur at the hip joint.
And when you look at the right knee in this position, the knee flexes, which means the angle between the femur and the tibia and fibula decreases. In knee flexion, the prime movers include the biceps femoris, the semimembranosus, and the semitendinosus. The synergists include the popliteus, which originates on the lateral condyle of the femur and inserts on the superior part of the posterior surface of the tibia, the gastrocnemius, which originates on the medial and lateral epicondyles of the femur and inserts on the posterior surface of the calcaneus bone via the Achilles tendon, the gracilis, which originates on the ischiopubic ramus and inserts in the medial surface of the proximal tibia, and the sartorius. The antagonists of knee flexion include the four quadricep muscles, which are the rectus femoris, the vastus lateralis, which originates on the greater trochanter of the femur and inserts in the base of the patella via the quad tendon, and the tibial tuberosity via the patellar ligament. The vastus medialis, which originates on the inner trochanteric line of the femur and inserts in the base of the patella via the quad tendon and the tibial tuberosity via the patellar ligament. And the vastus intermedius, which originates on the anterior and lateral surfaces of the femoral shaft and inserts in the base of the patella via the quad tendon and the tibial tuberosity via the patellar ligament.
Looking at the right ankle, you can see that the ankle seems to be in the same position as the last frame, but for this to happen, the ankle has to dorsiflect. If the foot was not dorsiflecting, it would just hang downwards, but obviously it stays at a 90-degree angle in this image. Ankle dorsiflexion happens in the sagittal plane and occurs at the talocrural joint when the ankle between the talus and the tibia becomes smaller. The prime mover for the ankle dorsiflexion is the tibialis anterior, which originates on the lateral surface and the lateral condyle of the tibia and inserts on the medial surface of the first metatarsal and medial cuneiform. The synergists include extensor digitorum longus, which originates on the lateral condyle of the tibia and the superior surface of the fibula, and inserts in the bases of the middle and distal phalanges of the second through the fifth digits of the foot. The extensor hallucis longus, which originates on the anteromedial surface of the fibula and inserts in the distal phalanx of the first digit of the foot, and the fibularis tertius, which originates on the anterior surface of the fibula and inserts in the fifth metatarsal of the foot. The antagonists are the gastrocnemius and the soleus, which originate on the soleal line of the tibia and the head and the proximal shaft of the fibula, and inserts into the calcaneus bone via the Achilles tendon.
Our third position is when the right foot makes contact with the ball. In this frame, just as the right foot strikes, the left leg remains in the same position as the last frame. Although it's tough to see, the left hip and the left knee are both slightly flexed, and the ankle remains neutral. Because I'm still balancing on one foot, the muscles that help stabilize and balance that we mentioned in the last frame are still contracting.
When you look at the right leg from the front, you can see the foot and knee are both pointing directly to the side, meaning the hip is externally rotated about 90 degrees. External rotation of the hip happens in the transverse plane and happens when the femur rotates away from the midline within the acetabulum, or the hip socket. Hip ER involves a number of muscles. First, the prime movers are the gluteus maximus and the lateral rotator group, which consists of 6 muscles. The piriformis, which originates in the anterior surface of the sacrum and inserts into the greater trochanter of the femur. The gemellus superior, which originates in the upper part of the tuberosity of the ischial spine and inserts into the medial aspect of the greater trochanter. The obturator internus, which originates from pelvic surfaces of the body of the ischium and the ischial tuberosity, and inserts into the upper border of the greater trochanter. The gemellus inferior, which originates at the posterior part of the tuberosity of the ischium and inserts into the medial surface of the greater trochanter. The quadratus femoris, which originates at the lateral margin of the ischial tuberosity and inserts into the quadrate tubercle on the intertrochanteric crest between the greater and lesser trochanter, and the obturator externus, which originates at the obturator foramen and the obturator membrane and inserts into the trochanteric fossa of the femur. These 6 muscles make up the lateral rotator group and are prime movers in the external rotation of the femur at the hip joint.
In addition, hip external rotation has 2 synergists, which are the sartorius and the gluteus medius. Finally, the antagonists of hip and external rotation are the gluteus minimus, which originates on the ilium between the anterior and inferior gluteal lines and inserts on the greater trochanter of the femur, the TFL, the pectineus, the adductor magnus, and the adductor longus, which originates on the superior pubic ramus and inserts in the linear aspera of the femur, and the adductor brevis, which originates on the inferior pubic ramus and also inserts on the linea aspera.
In addition to hip external rotation, the hip also flexes to a more neutral position. Flexion occurs when the joint angle decreases, so in this case, the angle between the femur and the pelvic girdle becomes smaller, close to 180 degrees. The prime mover is the iliopsoas, with help from the synergists, the TFL, the rectus femoris, the sartorius, and the anterior adductors. The anterior adductors consist of the adductor magnus, the adductor longus, the adductor brevis, and the gracilis. And in this case, the adductor muscle that is most at work is the pectineus. The antagonists of hip flexion include the main muscles of hip extension: the gluteus maximus, the long head of the biceps femoris, the semitendinosus, and the semimembranosus.
When looking at the right knee at contact, you can tell that it extends, which means it goes from a flexed position to an almost neutral extended position. The fully extended 0-degree flexion is labeled as fully extended because the angle between the femur and the tibia is restricted by the patella. In this case, the knee still has a slight flexion, as we can see from the front, but the angle at the knee joint is much greater than in the last frame. Knee extension occurs in the sagittal plane and has the 4 quad muscles as the prime movers. The vastus lateralis, vastus medialis, vastus intermedius, and the rectus femoris aren't assisted by any synergists, but have 7 antagonists. These include the biceps femoris, semimembranosus, semitendinosus, popliteus, gastrocnemius, gracilis, and sartorius. In this frame, the ankle is still in the same dorsiflex position as the last one, but this time it's easier to see how the toes point perpendicular to the sagittal plane because of the external rotation at the hip.
In the final position, the follow-through, the left hip is still flexed, although the torso seems to be more upright in this frame. Then it seems to be more leaned back. But if you look at the angle between the torso and the femur, it's still flexed, but the greater flexion at the knee makes his torso more vertical. At the knee, the angle is smaller than the nearly 180 degrees in the last frame, which shows the contraction of the knee flexion muscles that we discussed earlier. At the ankle, the joint remains neutral, but throughout the leg, the stabilizing muscles are still contracting in order to maintain balance on the one foot.
For the right leg, the hip is still externally rotated, which means the toes and knee are still pointed parallel to the frontal plane. In addition, the hip is flexed almost to 90 degrees, meaning the flexion muscles we discussed in the last frame are still contracting. In this frame, the knee looks almost fully extended, but because of the hip external rotation, it's difficult to tell if the angle between the femur and the tib and fib is actually 180 degrees, or whether there's a slight bend at the knee joint. The ankle joint is still dorsiflexed, which you can tell because the angle between the foot bones and the tib and fib is the same, nearly 90 degrees. The hip external rotation also makes it difficult to see the ankle dorsiflexion because the phalanges are perpendicular to the sagittal plane.